Good day, sir. I am Noreen Asuncion, Level 3 Nursing Student of President Limon Magsaysay State University. So for this video, I will be performing a return demonstration of assisting a patient with eating. So first is the goal of this procedure is for the patient to consume 50% to 60% of the contents of the meal tray. So to start, first is we need to check the medical order for the prescribed diet for the patient. And then we need to perform hand hygiene and put on personal protective equipment if indicated. And then after that, we need to introduce ourselves to the client and verify the client's identity using the two identifiers, which is the name and the date of birth. So, good morning, ma'am. I am Noreen Asuncion, your nurse for today. May I know your name and your birthday, ma'am?
My name is Francis A. Ipatiko. My birth name is February 13 at 2010.
Okay. So after that, we need to explain to the client the procedure that we are going to do, why is it necessary, and how the patient can cooperate. After that, we need to assess level of consciousness for any physical limitations and decreased hearing or visual acuity. And if the patient uses a hearing aid or if she wears glasses or dentures, provide as needed. And also ask the patient for any cultural or religious preferences and food likes and dislikes if possible. Then after that, we need to pull the patient's bedside curtain, assess the abdomen, and ask the patient for any nausea or difficulty swallowing, and also assess for nausea or pain and administer an antiemetic or analgesic as needed. And then after that, we need to offer to assist the client with any elimination needs, and then provide hand hygiene and mouth care as needed. And then after that, we need to remove any bedpans or undesirable equipments and odors, if possible, from the vicinity where the meal will be eaten. And then after that, we need to open the patient's bedside curtain and assist the patient to a high Fowler's position or in a sitting position in the bed or in the chair. And then after that, we need to place protective covering or towel over the patient if desired. And then after that, we need to check the tray if it is the right tray before serving. And after checking, we need to place the tray on the overbed table so the patient can see the food if able. And then after that, we need to ensure that hot food are hot and cold food are cold. Use cushion for hot beverages, allowing sufficient time for cooling if needed. And then we need to ask the patient for his or her preferences related to what food are desired first. And then we need to observe also for the swallowing ability throughout the meal. And if possible, sit facing the patient while feeding is taking place. If the patient is able, encourage him or her to hold finger foods and feed self as much as possible. And converse with the patient during the meal as appropriate. And if, however, the patient has dysphagia, limit questioning or limit the conversation that would require the patient to respond while eating. And play relaxation music for the patient to feel more relaxed during eating. And then after that, allow sufficient time for the patient to adequately chew and swallow the food, because the patient may need we need to rest for short periods during eating. And then after that, when the meal is completed, and if the patient is unable to eat anymore, remove the tray from the room. And then note for the amount and types of food consumed, and also note also for the amount or for the volume of liquid consumed. And then after that, reposition the bedside table, and then remove the protective covering, and then offer offer hand hygiene, and offer bedpans. And then after that, assist the patient to a position of relaxation and comfort, and then remove the personal protective equipments if used, and then perform hand hygiene. So that is all for this video. Thank you.